Hello friends, I'm here again today with another topic regarding the investigations, especially in the pediatric age group, that is in children. This age group can be divided into basically three types. One is from 0 to say 9 months or 1 year, and then 1 to 5 years and 5 years and beyond. The investigations which are essential in the age group 0 to 9 months or say a year, basically the complete blood counts. In the complete blood counts, we will check for the hemoglobins, which will tell us about the anemia if present. And this anemia can be of different types, mainly because of iron deficiency, the most commonly seen anemia in children. And for this, we need to do a blood smear, which tells us about the type of anemia, and various other investigations like the HPLC, which is a specialized investigation for finding out the different types of hemoglobins that are present in the blood. This also gives us an idea about the type of hemoglobin A2 if it is present, that is, which is indicative of thalassemia. And the other type, which is the iron deficiency anemia, and which is quite treatable, in that we can look for the peripheral blood smear and also go for the serum iron studies, anti-IBC, which tells us mostly about the type of anemia, whether it is iron deficiency or some other type. In the CBC, again, we have to look for the WBCs if there is any variation from the normal or they are within normal limits. Then for the platelets and various other calculated indices like the MCV, the MCH, and etc., which tells us more about the detailed study of the blood parameters and tells us about the different diseases that can happen in this pediatric age group. इसके अलावा जो हमको टेस्ट नेक्स्ट कराना होता है वो है ESR. ESR क्रॉनिक इलनेसेस जो कि डेवलप होती हैं बच्चों में उनके बारे में बताता है, और ये एक प्रोग्नोस्टिक टाइप का टेस्ट है, डायग्नोस्टिक नहीं है. Other than that, we can go for a CRP test. CRP is the C-reactive protein, which tells us about any type of infection that might be occurring in the child, because children are of this age group are unable to tell us about any complaints that they go through, and hence because of a low immunity, they are prone to various types of infections which are more commonly seen in the age group below 1 year, and therefore you should get a CRP done to find out if there is any persistent infection present in the child. Other than this, we can go for a smear to check the presence of any type of anemia, which I have already told. Other than that, any parasitic infestation if it is there. Another routine test which is very essential in this age group is the stool examination and also the urine examination. Urine examination because children in this age group, because of poor hygiene and also because of the low immunity in children below 1 year, they are prone to urine infections, and stool shows the infestation by different types of either parasites or the bacterial infections which occur quite commonly in this age group. I'm telling you only the basic investigations which are advised in almost all children of this age group, say at least once in 3 months or once in 2 months if there is no other indication. Iron levels usually go quite low in the children after 6 months and till the 9 months, because the iron stores which they acquire from the mother, they get depleted, and therefore the serum iron studies are very important, and if at all the levels are low, they can be supplemented from outside. The calcium levels also show a decrease, and if low levels are found, then we should go for a vitamin D investigation also, and then start giving calcium in these children. In the age group that is starting from 1 year to 5 years, because that is the runabout age group, children get infection from outside. They start going to school, they play with other children, so they are bound to catch infections, and therefore it is essential that we do a routine CBC along with the, if there is persistent fever or there is any other complaint of the child, then we can go for the investigations related to that particular complaint. Other than that, a urine test should be done to see if there is any proteinuria occurring in the child, since infections like nephrotic syndromes also occur during this type of age group only. And then we should go for a stool examination, because children do not maintain hygiene when they go to school or they play with other children, and because of that the parasitic infestations start happening more, and sometimes they become chronic and do not let the child grow properly. And because of this reason, one must get a stool examination done in this age group. Other tests like the cultures, especially the urine culture, should be carried out if we find that there is a repeated history of fever and no other cause is there, then you should go for a asymptomatic type of bacteria that might be present in such children. In this age group, we sometimes also see that there are deficiency diseases occurring, especially the deficiency of vitamin D, vitamin B12, and also other supplements like the trace elements. If they are not there present in the diet, the child is not taking proper diet, then such deficiencies are bound to occur. So we must go for the investigations regarding which measure the levels of these elements, and vitamin D and vitamin B12 and other vitamins which are required. And even if you do not go for the investigations, at least one dose of such things should be, like the vitamin A, etc., should be given to the child before going for these investigations. After these investigations are being done and we find out that the child has grown from further from 5 to say 12 years age group, then we go for the investigations. Other than the routine investigations, we go for investigations which are related to the growth of the child, like the growth hormone, and also check for various deficiencies and supplements which might not be there in the child, and they have to be supplemented from outside if the levels come low. Hence, today I have tried to give you a very short view of the different type of investigations that can be taken up in the pediatric age group, different pediatric age groups, and they might be of some help in finding out the cause early in such type of children, so that if at all there is deficiency developing or there is any particular disease developing in the children, they can be diagnosed early and treatments can be done accordingly. Thank you so much.